All right, well, in health news, it's that time of year again. Cold and flu season is upon us, and the best way to prevent influenza is with the flu vaccination.
The needle. Now there are some changes this year, and more with that. Dr. O'Meara and Kris, who's the supervisor for the immunization program. Sorry, I had to stumble through that one. Good
That's
morning,
a big
ladies.
word on a Monday morning.
Immunization.
Thank you so much.
Now, I've heard just recently that, well, we've always had options. We've had the nasal mist, and we've had the needle, the shot, and that is going away this year. Is that accurate? We're really focusing on the needle. Is that true?
Yes, that's...
I'm not to focus on the needle. I always look away. I always want to focus on the needle. But
Yes, that's correct. This year, the CDC's Advisory Committee on Immunization Practices have vote to uphold the recommendation against the nasal flu vaccine for this season.
Okay, so why is it so important for everybody to get the flu vaccine, or is it not so important for everybody? Is there a certain age range that we're kind of focusing on?
The flu vaccine is recommended for everybody, actually.
Okay.
And the flu, as you know, can cause illness and death. For example, last year in the United States, there were 68 pediatric flu deaths, and one of those did occur in Michigan. Getting a flu vaccination is the first and best way to prevent influenza. It prevents both doctor's visits and hospitalizations.
And I know this time last year I was actually getting walked down because that's about the time I found out I was pregnant. And instantly, that was the first thing they said, you need to go get your flu shot right away. So very critical for the pregnant females too. Yeah.
And Kris, you're the director of immunization, so tell us why the nasal spray, which I'm sure most kids would opt for, isn't being used this year.
Right. So the CDC did recommend this year not to use the nasal spray because they deemed it was ineffective. Last year they did some studies and it was only 3% effective. And so they're recommending to use just the shots this year.
Well, that's obviously something you want it to work if you're going to go through it. Okay. And what a lot of people say, you know, I don't like to get a flu shot because it makes me sick. You know, I have a chance of getting, but I hear that from time to time. Robin, what can you address that?
Yeah, so that's a really common question in my office with patients. The flu vaccine, the shot, doesn't contain any active or live virus. It's just actually kind of proteins that are broken down, so there's no way to actually get the flu from the flu shot. The sometimes rundown, crummy feeling you have after you get a flu shot might be your body's own immunity kind of ramping up, and that does happen a little bit. I think the body tries to tell you to slow down when you're feeling sick, and that happens when you create an immune response as well.
Does it take a little bit of time to kind of get in your system? Is that why now is so critical?
Yeah, so the CDC recommends as soon as they come out with the flu vaccine that everybody start. It does take a little while to build up immunity, at least 2 weeks. So you want to get it as soon as you can. And the flu actually does start seasonally. It depends on the year, but it can start as early as September, and it can run all the way through April.
I think here in the office, a lot of it's going around already.
Sure, yeah,
so,
a lot of sniffles. And Dr. O'Meara, when it comes to vaccinations, a lot of times people say, I should have done this sooner because now we've run out. Is there a certain number? I mean, we try to estimate how many the season, is this going to be a bumper crop, I should say, for
I think there's plenty of flu vaccine this season. The CDC estimated that between 171 and 176 million doses would be manufactured this year. Of that, about 8% was that nasal flu spray that we're not recommending. So there should still be plenty for everyone who wants to get a flu vaccine.
Okay. So the big question is, Kris, where can everybody go to get this flu shot?
Well, you can go, there are flu clinics. You can go to your Spectrum Health Medical Group primary care doctor. You can go to urgent care centers. You can visit our website at spectrumhealth.org/flu, and there's community clinics around. If you're a business owner or a HR director and you'd like to host one at your business, you can go to that same website and we'll do an on-site flu clinic. We'll come out to your business and do one there.
Make a trip to the HR just as painful as it usually is.
We want to make it as convenient as possible.
Yes, convenient. That's what I meant to say. I meant to say convenient.
So people can't say, oh, I didn't have time to do it. Oh, yes, you did. You had a couple minutes to start into the...
We're trying to make it easy for you to get your flu shot.
And obviously, I have children. I have 2 daughters. So when it comes to the flu shot, I would normally go to my pediatrician, my family's pediatrician. If I go to, you see these in Walgreens and CVS's. If no matter where you go, the vaccination is the same. Is that correct or no?
Well, there are different vaccinations.
Okay.
So there's a trivalent, there's a quadrivalent. You're going to want to check with your primary care physician to find out what really is best for your child or for yourself.
Absolutely.
Good to know.
Thank you.
All right. Thank you so much, ladies, for stopping by. All right, for more information on flu clinics in your area, call 616-486-3939, or once again visit spectrumhealth.org/flu, or to schedule a flu clinic, as we mentioned, call 616-486-3050. All right.